My name is Mike Pishvaian. I'm an associate professor in gastrointestinal oncology at Johns Hopkins University School of Medicine. So one of the topics that comes up from time to time is the role of liver transplantation for patients with cholangiocarcinoma. I have to admit personally, I haven't dealt with this discussion much because it is really center dependent, where some centers are very aggressive about doing liver transplantation and others are not. The background to this is the fact that 5-year overall survivals for cholangiocarcinomas are not great. Even resectable cancers have only about a 25% 5-year overall survival rate. And unfortunately, cholangiocarcinomas, given their location, sometimes in very precarious areas like in the hilum, or even when they're intrahepatic, they can be multifocal. Many of these cholangiocarcinomas are actually unresectable at first diagnosis. So people have looked at the potential for doing liver transplantation just because most of the disease or all of the disease is within the liver, and perhaps replacing the liver could actually help improve survival. Early on, studies were not promising, but then people started using neoadjuvant chemotherapy or chemoradiation therapy, and there started to be more promising results. In 2012, Darwash et al. Published a paper looking at liver transplantation after neoadjuvant chemoradiation for patients with hilar cholangiocarcinomas, and they had a 5-year overall survival rate of 65%. More recently, Lunsford et al. From the MD Anderson and Houston Methodist group looked at intrahepatic cholangiocarcinomas treated with at least 6 months of neoadjuvant chemotherapy, and their 5-year overall survival was 83%. But there's a lot of caveats to this study. First of all, for example, the Lunsford trial was only 6 patients who underwent transplantation. So these are highly selected patients. The median time from diagnosis to transplant, just because sometimes it takes a while to get a liver, was 26 months, which is far longer than the median overall survival for an advanced cholangiocarcinoma patient. So these were patients whose tumor had proved to be very good biology. But overall, what I would say is that the cure rate for patients who have resectable cholangiocarcinomas is not great. And if they're in a very multidisciplinary fashion, liver transplantation could be considered for very highly selected patients, then I think it's certainly worth a discussion.